Hi, I'm Marc Koska. I'm delighted to welcome you to this series of videos that are going to look at innovation, manufacturing, and how we can help develop the world of safer and more accessible injections for all. This is going to be a very interesting series using people inside and outside the ApiJect group, and I'm sure you're going to enjoy these conversations. So, Heidi, it's great to see you here.
And you.
This is, I know, number 9,432 of the Innovation Chronicles, which we have the pleasure of interviewing people who are deep within the subject and have very interesting backgrounds and views on innovation in healthcare, essentially. So it's brilliant to have you here. Thank you. And I know your time, you're one end of the world to the other on a constant basis. So thanks for stopping by.
One of my favorite places to stop.
Well, it's great to have you. So I've got a list of questions, and I will sort of read out them and interpret them, and as
Great.
the conversation goes, and we'll chat until you have to leave. So that would be wonderful. All right.
Yeah.
So anthropology. Why anthropology for you?
Well, I actually started thinking I was going to be a biomedical engineer. And fortunately, you get electives in university, and I started to take social science, and I just got fascinated by kind of the human factors involved that make it possible and acceptable for technology to get where it gets. And that was a long time ago, but in the meanwhile, I've stuck with health, but it um, around products, but around different types of health interventions. But I did have a bit of a detour that I hadn't expected. And that was after I finished my PhD, I got approached to come and be an anthropologist in Silicon Valley for a couple of years.
That was a lot of foresight by
Yeah,
someone.
yes. Somebody said, we need what you do. And that really was great because I was really immersed in the labs with the developers about it, Xerox PARC, which used to be called the MIT of the West Coast, and also at Apple Computers, trying to introduce computers into classrooms was pretty inhibiting to some teachers, and I did a lot of ethnography there. But moving over to PARC, there was a whole mix of different kinds of innovations going on, and it's really finding this interface between people and technology, which we're more immersed in than ever. And unfortunately, sometimes the people factor traditionally in developing new products, it's usually like the last thing people think of when it's ready for market. Let's do some market research rather than pulling it back to the design stage, where actually it can have a lot more impact and a lot more utility to understand what fits, what works, what's the flow. So that's kind of how it all got started with me for anthropology.
We have the same thing here because we do what we call field research to find out people's basic inclination towards one design or another.
Yeah.
But of course, in medical products, there's human factors as well, which is a lot more to do with when the product is final, how you present it. So are the instructions for use clear, etc. So going back a few years then, when you were at Apple, for example, people like, I'm sure he wasn't the kingpin all the time, but someone like Steve Jobs, is he an intuitive anthropologist, or was he he wasn't scientific in his approach, I guess. He probably just was gut feel.
Well, I think it was really in the one computer per classroom campaign. It was more, they called me because they were getting resistance. It wasn't that, up top in the CEO's office, he said, we want to embrace anthropology. They hit a wall.
Mm,
And that's when they said, we need somebody to help understand what's going on here, and how can we make or help teachers understand that this is not threatening their knowledge base.
mm.
This could kind of support it, in fact. So I don't know, but I don't think that he had a particular. I think he appreciated it over the years, the value of it, but it didn't come from the top. It came from
Bottom up.
the bottom up, as we were talking about.
Yeah.
Yeah, yeah,
Yeah. And just a little bit off topic, but when you see innovation come into the world, whether it's a computer or a
yeah.
car or a battery or solar, do you do you see themes of, your subject in those presentations, the way that they're delivered to the marketplace? Because obviously there's a lot of disruption going on
Oh
now with
yeah,
technology,
constant. Yeah,
and in the end, it's based on a core human desire for either, an improvement or a better product, or I've got something that you haven't, whatever the
right,
motivation is.
right.
When you look at something coming out, do you sort of chuckle to yourself and go, I studied this, a long time ago, or,
Yeah, and it's interesting. I think that and things have evolved since then, and some of it is because of the feedback along the way. I mean, one of the things that that Park, Xerox Park, I think it's just called Park now, um, really understood, and partly inspired by, there was a big collaboration with Sony in Japan, and and they took a very different approach in Japan, which was to throw out into the marketplace early, produce less, but get it out to people early to see how they're using it, which made total sense. Because also, one of the things, as much as I'm a big fan of listening and getting people's input along the way, with some of the innovation, if it's really quantum innovation, people don't really know. I mean, for instance, with the touchscreen
yeah,
iPhones, a lot of people, if you just did your, market research, would have said, "I'm sticking to my
yeah,
keyboard,"
no, not for me.
And if a company said, "We're not going that way because people don't want it," sometimes you just have to have enough confidence that maybe not make a zillion of them, start smaller, but then get it more familiarized.
Mm,
So I think there's this balance between pushing the edges and listening to people along the way. And but then, I think people use things in really different ways sometimes than, the engineers and the designers anticipated it, which can be really rewarding, that you see, oh wow, we were so focused on getting that, and then they're repurposing it for good or for bad for
mm.
for other things, and that's an exciting thing to follow that journey.
And some of your conclusions go in both those directions, I guess,
Yes.
when you're
Yeah.
giving guidance. Yeah,
Yeah.
yeah, amazing. So if we move on a little bit into vaccines, you then had a stint at UNICEF.
That's right.
And what was the, without naming names or
Yeah.
being
Yeah.
too pertinent about it, what were some of the challenges that they were presenting when you joined, and what were you able to steer or achieve?
Well, I had been in UNICEF for several years in the field in Nepal and the South Pacific, and
As
as with UNICEF as a program officer, project officer, working in the field on different aspects of health,
okay,
and it was actually my earlier years in UNICEF that reinforced my passion for the reason for anthropology. Um, and but then I had moved to WHO for a while, and then I came back to UNICEF because it was for the launch of Gavi, and there was a whole new era of introducing new vaccines, and that was my my role was to support the introduction of new vaccines, and thinking that it would be more positive strategies and engagement, communication, listening. And I earned the nickname the director of UNICEF's fire department because we had so many, and I had a bit of a global look that you wouldn't have seen in any newspaper. Um, um, I saw so many instances of just resistance to some of these new vaccines for different reasons. Sometimes it was a government official who was, saying enough already, or we have to make it to the finish line with the older vaccines before we, and sometimes it was a community who had their issues with it. Sometimes it was a different group, and it was kind of popping up all around the world. Um, Rumors were rampant, of course, and but the problem is that the field staff were kind of wanting to brush it under the carpet that they'll go away because this is a good thing. And they weren't going away. So it was during that period from 2000 to 2005 that while there was progress, not to say that there wasn't progress, but I realized that there was a growing amount of questioning and issues going on, partly fueled. I mean, we shouldn't forget that Google opened their doors in 1998. When I started seeing this was even before social media. I mean, it was Facebook, I think was 2006 too. That was after that 5 years, which has only escalated, but it was already coming up. And a lot of people, particularly in public health, didn't really want to hear that story. They're like, focus on the good stuff. Don't amplify the bad
Don't
stuff.
take risks.
Yeah.
Yeah.
Well, if you focus on trying to study the negative stuff,
Yeah, it's a
it's
big
gonna
hole.
it's gonna
It's a
bring
deep hole.
attention
Yeah.
to it.
Yeah.
Yeah. And people didn't thought it was fringe, it was crazy people.
What do you do? How do you tackle a resistance point?
Well,
Whether it's political or
yeah.
media or
Well, I
public.
think the main thing was to try to understand where it was coming from. I mean, at one point I put a sign on my desk saying, "Communication can't fix a problem you don't understand." And because I would have people coming in my office saying, "I need 3 posters or 2 videos or whatever," and I would say, "Well, let's think about what you need after we talk about what's the problem, what's the issue," you know. And but I did buy some time in my schedule to focus on getting a little more research into my work. But there was one point where I realized this was too big of I didn't have the bandwidth in my day job to really do what I wanted to do. So I decided to leave UNICEF and set up what I called the Vaccine Confidence Project. In Launched in 2010, actually, by the time I got seed money and got it up and running. So that's 14 years ago, and it's still running strong. Really mapping, doing both global metrics around confidence, but also understanding what's driving it, what are the differences, and getting basically a culture of research around this issue, and not just saying it's about the message, which a lot of times it's not at all about the message.
And is that just you, or do you have a group,
I've
a small
built
team?
I've built quite a good sized
And
team,
they're
but
international?
international. It started in London, but is increasingly decentralized.
How
We have
many in the team?
well, we have uh, about 12 that are specifically in the Vaccine Confidence Project, but we have a lot of collaborations around the world with
Sure.
partners. So we're kind of the we're the energizers, but a lot of the work is getting done. We have a strong collaboration with Africa CDC, with Pasteur Institute, for instance, in Africa, with Hong Kong University on our AI work, and yeah, different universities and research centers.
Perhaps AI should be our last topic that we get
Yes,
to at the
yeah, well,
end.
that's an
Yeah.
important one.
Um, we were pointed out a lecture by Rory Sutherland the other day, who
Okay.
I can't remember whether this was original for him or whether he was quoting someone else, but he said essentially there are two types of people in the world: those that want to win the argument and those that want to solve the problem. And it sounds like your plate on your desk was, let's solve the
Yes,
problem. No,
yes,
we don't need to
exactly.
hit this with a hammer. Let's
Exactly.
understand what the hammer is hitting before
Yeah.
we start hitting it. So that certainly aligns with what we're doing here. Okay, so moving on from there, France. What a
Oh,
taking a view of
yes. Yeah.
France. Where does vaccine hesitancy or acceptance rate there, and are they the outlier?
Well, to my surprise, actually, when we developed our vaccine confidence index and then we did our first global run with it in 2015, globally, Europe came out as the most vaccine skeptical. I was thinking it might be the US, but I suppose if you disaggregate the US by state, it would look a bit more like Europe. But France, in particular, was the most skeptical in the world. I think it was 41 or 42% did not agree with the statement
Wow,
that vaccines are safe.
wow.
And it was the cover of Le Monde. It was all over the French press. I thought they might call me, the ministry might call me and say, this is rubbish. Instead, they called me and said, thank you. We knew we had a problem. You've helped us understand how big of a problem we have by putting it in perspective. And to the credit of Europe and the EU, they actually started a whole joint action initiative to build confidence in vaccines, address the hesitancy, because soon after this study, there were these massive, massive measles outbreaks, 80,000 cases of measles across the greater Europe region. That's beyond the EU countries into the Eastern European, but still massive amount. So between kind of our research findings and this massive outbreak, they really ramped up the attention to this. And to their credit, we've been monitoring every 2 years with the EU confidence, and it has gotten better in some places. COVID has taken a global hit on public confidence in vaccines, so including in the EU.
And where does the resistance or lack of confidence come from in France? Is it historical that goes back to one of the presidents or emperors or?
Yeah, um, a lot of around the world, as with France, it is historic episodes where there was a trust breaker with the government, and it doesn't even have to be about vaccines. I mean, there was one episode where there was HIV tainted blood in the blood bank um, that was eventually reported to the public, but it took a little while. And when they did find out, and then found out when the government knew, people were outraged. And then another thing that happened was around the H1N1 pandemic in 2009, the public felt like the government was way overbuying vaccines for what they didn't see as the big thing that they was predicted. So these kind of things, and then there are a number of issues, court cases around HPV. None of them have proved to be a problem with HPV, but anxiety about safety. So it's usually a mix of historic episodes, um, safety concerns. Sometimes it's a religious issue, like Muslims are hesitant about vaccines that use porcine, like the
Sure,
gelatin, either
sure.
in nasal flu vaccine or polio. So it's usually a mix of things. But history weighs in big. I mean, in the UK, the episode with Andrew Wakefield's Lancet paper and the suggestion that
Thimerosal, yeah.
MMR causes autism, or the triple vaccine MMR, um, came on the heels of the what was called mad cow disease at the time, um, that the government had kept telling people it's okay, there's no problem. And so, the public felt like you just lied to us about that. And why should we believe you that actually this vaccine's okay?
So essentially, it's a cumulative
Yeah,
set
it's a
of
cumulative. And we should remember that, yeah.
mistrust. Yeah.
And I think for policymakers and governments, every day we're making history. So the importance of keeping that trust relationship is really important.
So on COVID, who's the winner and who's the loser? Who was the most misleading government, or the one that caused the biggest lack of confidence?
Well,
And who was the winner?
a lot of countries around the world took a serious hit in their vaccine confidence because we had a lot of background data on vaccine confidence. We compared 55 countries with where we had a lot of background data and reran it in 22 and 23. 53 out of the 55 had a not insignificant drop in confidence
Goodness.
in the importance of childhood vaccines, not just about the COVID
Yeah.
vaccine.
Yeah.
So that's a problem. In some cases, the leaders were misleading. I mean, certainly Bolsonaro telling his public that the mRNA vaccine will turn you into a crocodile or alligator. I forget which it was. Certainly in the US, there was misleading information.
Nothing wrong with bleach.
Yeah, right. Don't take the vaccine. You can just gulp,
Guzzle, yeah.
guzzle.
Clorox. Yeah.
Yeah. But it's usually a mix of different things. And there was a lot of conspiracy. I mean,
Yeah. Well, if you upset people, then you get attention, don't you?
yeah, it was a big vaccines, I think, attract a lot of rumors and conspiracy because it's so global. It's counted everywhere. And with the pandemic, it was even more global. It wasn't just about children. So everybody in the population was going online looking for vaccine information. And many people were pretty shocked at what they found because a lot of people who weren't paying attention to vaccines before, um, didn't know that there was this very um, negative as well as positive information on vaccines.
Yeah, I didn't
So,
even think about it until
yeah,
it was
and
pointed
all of a
out.
sudden they are starting to ask questions. But
Yeah.
but safety is a big anxiety, and that's why I'm so thrilled with what you're doing here.
Thank you. It's during the pandemic, I read quite a few books on smallpox, and I was amazed. I mean, you think of the situation where I was reading about Iceland, and they had, tens of
Yeah.
pandemic outbreaks of smallpox over hundreds of years,
Yeah.
and you can see them as an isolated country. A ship sails over the horizon wanting
Yeah.
to do trade or seeking safe refuge. It's like, whoa, here comes another one, and there wasn't a vaccine.
Yeah.
So,
There was.
we've lived, most of human history has been without the correction of
Yeah. The
medicine, if you
opportunity.
like.
Yeah.
And we've just sort of, I suppose, there must be in our DNA some fear of that disease or the treatment of the disease, because the vaccine is a replicant of the disease to
Yep.
fire up our immune system. But also, the other thing I
Without
found,
killing you.
yes,
Yes.
with a good result.
Yes.
Well, it's a fire up of our natural immune
Yes,
system, isn't
yeah.
it? But what I also realized during the pandemic was how little people knew actually about immune systems, and how
Oh,
little people knew
it's
about
amazing.
biomes,
Yes.
or
Yeah.
even how many viruses there are on the
Yeah.
planet, and it's a
Yeah.
huge bio
And
load.
constantly evolving.
Yeah.
Yeah.
And they
Yeah.
don't mean any harm, actually. They're quite,
Yeah.
they're just
Yeah.
going about their
Some of them.
business.
Yes.
We just
Yes.
happen to, well, they
Oh,
cause
oh,
harm, but
yes.
they're not,
Yeah.
their intention isn't. And
Yeah.
of course, there is a human characteristic to anthropomorphize
Yeah.
these little inanimate objects, isn't it? And
Yeah.
oh, they're evil, but of
Yes.
course,
Yeah.
you know,
The
they're just,
battle against the virus.
yeah, and
Who
of
was
course,
it? Pasteur who said the virus always has the last stand.
yeah,
Or I think it was, I might have
yeah,
gotten it
probably.
wrong, but
So moving forwards, digital analytics,
yeah.
where's that going to take your field of work? Where's it going to take not only yours, but the whole understanding of
Well,
how we look after people
we're
better?
using AI in a lot of different ways, but one is to accelerate on our listening. And we, for instance, in Asia, out of our Hong Kong group, we're doing a lot of social media listening, but harvesting a lot of the conversations, trying to understand what's motivating people, what's discouraging people from vaccines, to inform chatbots. So we're doing a lot with chatbots now because one of the issues that people tell us about is, you know, we go online looking for information because that official source doesn't have the information. They don't have the answers to our questions. I mean, when some of the social media companies started flagging when a vaccine issue comes up, they flag go to, the NHS or
Mm,
go to
mm,
CDC
mm,
or go to WHO. Some of the parents say to me, we've been there, but they don't have the answers to our
mm,
questions.
mm.
So that's why we go to other sources. Not that, I mean, I think for first time questions, that's a good thing to have that flag. But for the people who already have passed that, so with the chatbots, we can be much more responsive to people's concerns, be learning what they are. So that's one application. But we're constantly thinking of new ways to use AI. Part of the challenge, and I think this is just the evolution of this, particularly related to the generative AI, but because a lot of it's harvest from what's out there, sometimes we need more forward looking, and we're seeing a bit of the same things we were talking about earlier when we need a whole new approach.
I agree. I agree. We have been stuck, even in, what we do, the production of vaccines and
Yeah,
mechanisms to get it into your body. I think, the most promising technology is going to be patches, probably,
yeah,
because
microneedle,
we
yeah,
we can it's I mean, I don't believe in the fear of needle theory myself in when it comes to practical.
yeah,
Look, you can either be ill or this is
yeah,
going to take 3 seconds. I think
yeah.
there is an understanding, and you
There are
could,
some people that have a genuine, but it's
of
it's a
course,
it's a minority. I
I'm
mean,
not belittling people who won't have an
yeah,
injection for
yeah,
that reason, but there is it's perceived to be a lot bigger than it
yeah, yeah,
actually
I
is.
agree.
And this kind of leads on to, an injection's an injection, and we're probably going to have that for a good long time because a lot of these APIs, a lot of these drugs and vaccines, etc., are already approved for that
Yeah,
method of
yeah,
delivery. And to to reverse that and make it transdermal is going to be a massive weight to
yeah,
push through regulatory,
yeah,
stringent regulatory pathways. So I think that's going to be its
yeah,
main thing. But bring it on. I'd much rather
yeah.
have
Yes,
them arrive by mail and you put
yes,
something on and
yeah,
even
yeah,
take your daily vitamins that way, would
yeah.
be,
Well, already with dermatology, I mean, they're using
yeah.
a little bit of it, but there are some places in the world that, people feel like if they don't get an injection, the doctor's not doing anything for them. So
Yeah,
some places actually really prefer that mode.
exactly.
So
And there's a mistrust of oral as well because
yes,
they don't
yeah,
feel
yeah,
that they've been delivered. So sort of the final big chapter on this chat, what what are the other solutions other than giving vaccines better, more efficiently and delivering more vaccines? We know vaccines work,
yeah,
but what else can we do? Can we isolate? Can we take precautions? Can we have an improved level of hygiene or diet or
yeah,
or awareness or information? What else has to go along with your work, if we just relied on vaccines, it seems like there's always going to be many
Limit.
more barriers, especially with
Yeah.
social media and
Yeah.
AI and bad
Yeah.
actors. There's always going to be new barriers thrown in. What can we do as a race to prepare ourselves to be fitter to face these future pandemics?
Yeah, I think, well, one, it depends on the virus. I mean, there's some that, isolation is more effective than others. Some, it's a lot of other behavioral issues. Sometimes, I mean, we have more and more therapeutics coming up that um, are, I mean, even vaccines, frankly, that are actually not for prevention, but
They're
interrupt.
preemptive.
Yeah,
Yeah.
like for TB right now, there's a number of very promising candidates that, for those exposed to TB, one out of, I think it's 1 out of 10 who ever gets sick, um, it will interrupt that progression from infection to disease. So there's different kinds of, we think of vaccines as being primarily preventive, but they're also therapeutic. So but there's different kinds of medicines. But I think behavior and prevention, we don't invest enough in that because there are ways. But I mean, going back to the perceptions about the immune system, drinking a lot of whatever from the health food store to boost your immune system is not going to prevent viruses. It may help you recover better, but I think we also need to be aware that some of these viruses are out there, and we need to have these tools.
Sure. Sure.
But we also see that a super important thing is not everyone responds to the same vaccine the same way.
Mm,
It depends on your health.
mm.
I mean, we saw in certain places with polio, the most undernourished don't respond the same way. And there's certain with senescence for vaccines for life. It's different when you're older. You don't respond in the same way when you're younger. So there's a lot of other things we can do just to keep general health boosted, and that will help. But it definitely needs to be a collective. And hygiene is top of the list. For instance, with cholera, if you can have fantastic oh, cholera vaccines, which having more oral cholera vaccines, but you don't want people to. I mean, hygiene is absolutely important, and that's a big issue in the world,
Yeah.
bigger than I think we take water for granted in some parts of the
Yeah.
world.
You often hear when there's an earthquake or something, the big threat is the
Oh yeah.
cholera. It's not the earthquake
Oh, and the
itself.
number of refugees in the world these days who access to even basic water is really threatening. Yeah.
I guess, there's so many different layers to this because it isn't just, having your ginger shot in the morning from the health
Yes.
food store, which isn't going to stop a vaccine, a
Yeah.
virus, of
Yeah.
course. But,
It may
you know,
stop you from getting a vaccine
yes.
if you really believe in that ginger
Yeah,
shot. Yeah.
but that's actually the point, is that
Yeah.
there's a mental awareness as well.
Yeah.
There's a
Yeah.
spiritual, mental, and physical awareness
Yeah.
that is probably going to be the solution. It's going to be a
Yeah.
multi-party approach, isn't it?
Yeah.
That in
Yeah.
the end is going to make us much more aware that and to make more conscious decisions rather than
Yeah.
be swayed.
Yeah.
And
And have choices. I mean, I think one thing that in the risk research, I do a lot on risk. It, People are much more willing to take something if they feel like they've had a choice. There's like three key things within risk communications, risk science, in terms of people's willingness to take a risk. One is voluntary versus involuntary. Much more willing if they're voluntary. There's natural versus chemical or non-natural.
mm,
Much more if it says natural, much easier sell than
yeah,
and the third one. I can't remember the third one, but Anyway, it's having some sense of control over
Mm.
it, making it as familiarity, that was it. How familiar or unfamiliar is it? That was the third one. So if you even if it's not even if it's a new thing, are there equivalents that you can say this is like X?
Right.
This, new vaccine patch is not that different from the one you used for
Yeah.
for your
Or better than raw
cosmetics.
carrots,
Yeah,
or
yeah,
some
yeah,
analogy
exactly.
that
Yeah,
leads you. Yeah.
yeah.
Fabulous. And final word on the Riga Institute and your work there?
Yes, Rega in Leuven.
Mm.
Well, I have two affiliations in Belgium. One is with University of Antwerp at their Vaccinopolis, which is an amazing facility, and we have our vaccine confidence group for Europe there, which we opened post Brexit. It's part of our global network, and then at the Rega Institute, really doing a lot of interesting work around. Innovation and anthropology and technology, but also One Health. Thinking there's more and more work considering One Health and actually vaccines in animals. That's another kind of prevention is with the growing pressure between people and animals with drought, with other being pushed out of areas, that interface means we're going to have more and more zoonosis viruses jumping. I mean, we're in the middle of who knows which direction it's going, but with the current H5N1
Yeah.
concerns.
Yeah.
So that's another, to get back to your earlier question, vaccinating animals.
Okay, well, fabulous. Thank you very much, Heidi.
Great to see you.
Yeah, really good to see you, and we look forward to seeing you again soon.
Thanks.